Hi, so I'm Thomson. I'm a social worker here in the clinics. Up until recently, I was the social worker in the Down syndrome clinic, but my position has recently evolved and changed. But I know many of you got to meet Amy Lyle, who is the new social worker in the Down syndrome clinic. She's out at the resource center table today, so you guys are lucky to have her. Our job today is really to start thinking about that transition to adulthood. And the reality is we could spend our entire day talking about this and still not have enough time, but we've got 30 minutes, so we're going to talk a little bit and give you things to think about and some resources to access at home. That way you've got a place to start from as you're thinking about your child's transition to adulthood. And we know that this is a journey and that this is a path that takes quite a bit of time, and you don't always know what the end result is going to be. But we can start sort of charting that course. It's going to make it smoother for everybody, for you, for your young adult with Down syndrome, for all the people in their lives, so that it goes smoothly. I'd like to say that that's going to be an easy job, but we all know that that's not true. We all know that this is going to be difficult, and really helping any young adult get to adulthood can be fraught with some challenges. And so we want to think about what are the things that need to be considered as we're thinking about what really sets us up for success and really sets your young adult up for success as they make that transition from being a teenager to being a young adult. So this is, studies have been done saying what really makes a good life, and really looking at folks with Down syndrome and what parts of their life are necessary, what things do they need to have in their life in order to be successful. And I know this is going to be surprising to absolutely no one, but having relationships, being involved in your community, having some sense of independence and autonomy, and then hopes for the future. Of course, those are the things that make a good life. So we're just going to briefly go through each of those sections and think a little bit about what are the things to be considering as parents, as a young adult, what do we want to be thinking about as we're making that move. So when you're thinking about relationships, what is your young adult's role within your family? That changes over time from being a child to being an adult. And what are your relationships with the other people in your family, with siblings, with parents, and how do you navigate those relationships as you get older? We want to think about friendships. What are the social activities that your child is involved in? Is it only in school? Are they in activities outside of school, whether it's through church or through Special Olympics or any of those other things that they're participating in? Because we know that having those peer relationships are what's truly helpful in making that jump to adulthood and making those connections and continuing on with having a good life as you get older. You also want to think about romantic relationships and what are your values as a family, what are the things that you want your children to think about when it comes to having those romantic relationships. I think sometimes we want to kind of brush that to the side, but we want to think about what those relationships are going to be like, whether the parameters that you want to put in place as a family, whether your beliefs about those relationships, and start talking about them early and often. And regardless of a disability, you want to make sure that really everyone is understanding how those relationships should work and what that might be like, because it's an important part of having a full, good life. We also want to think about being involved in the community. And now Sharon, our wonderful OT, is going to spend a lot of time with you guys later today talking about how do you get there, what are the skills you need to build in order to really be fully involved in your community. But what I want you to think about is really what's the overarching goal? We know that you've got lots of options when it comes to education. Is your child going to leave school at 18? Are they going to stay until 21? Are they going to seek out any sort of higher education or job training? What's the plan for them to continue to grow? Because we know that we want folks to really maximize their potential and really thinking about what's in their best interest. In the same regards, we want to think about employment and what's the plan for after high school? Are we really working with your young adult to think about finding work that's meaningful and enjoyable? So what we don't want is people graduating from high school and then sitting at home all day long, because we know that leads to depression, that leads to a lack of satisfaction in your life. Think about for yourself, if you were kind of home by yourself all day, every day, what that would be like for you. And we want to make sure that folks are able to fully participate in their community. And then we also want to think about social activities and the fun things that we do and that we are engaged in within our communities. And so really building those things into that plan for adulthood. You also want to think about decision making, and when your child is turning 18, thinking about who's going to be making medical decisions for them. What is their role within those decisions? Where are they going to live? Is there an opportunity to live independently, live with some peers, having a supported living environment? Will they be living at home with you? What's the plan for when you, as parents, are at the point where maybe you're no longer able to provide that care? We want to have those plans in place now because we never want to be making decisions in a crisis. We want to really think about these things when everything's going sort of smoothly and well, thinking about what's the long-term goal, because that's going to help everybody to be successful. That's going to help you as parents to feel like you know what the plan is. It's going to help your young adult to feel like they've got some say and some control in their life. And so we want to find that balance between what are they capable and interested in doing in terms of making decisions, and then what are the things that really need to have somebody else's involvement. And it's not an all or nothing thing, but it's really thinking about finding that balance and making sure that you're able to have those conversations as a family. Okay? And then finally, we want to make sure that we're talking about what are our hopes and dreams for the future. We want, whether your hopes and dreams for your child, whether your child's hopes and dreams for themselves, because having that ability to look towards the future and to really have those plans are really what helps you to have a good life. And I think we know all of these things to be true, but I think sometimes we get so bogged down in the day-to-day of raising kids and getting through life that we don't always plan for the future. And so that's really what our goal is today, is really just giving you these little snippets of things to think about and thinking about how we make that move towards the future. And there's so many pieces to that puzzle as you're thinking about planning for a whole life and planning for adulthood. But the more that you are able to have those conversations and have those things to think about, the more successful that transition is going to be, the smoother it's going to be. And so I'm going to turn the reins over to Maria. She's going to talk a little bit specifically about that healthcare transition, and then we'll have some time for questions.
Thanks, Erin. I'm Maria Stanley. I'm medical director here at the Waisman Center and also director of the Down Syndrome Clinic. And I'm going to talk to you a little bit about health-related issues with transition and also about the healthcare transition process itself. And Erin and I were joking this morning before we started that this really could be a whole day just talking about transition. So I feel like it's a little bit of a flyover view of the big picture, but I'll try to do at least talk a little bit about some of the things to think about. Just to start out with, one of the pieces in terms of planning for a person's future related to health is really building health habits. And like everything else, health habits start early. And one of the big things that I think is something to think about is particularly the issue of obesity. And we know that people with Down syndrome are at higher risk for obesity. I think there are a lot of different reasons for this that have, and we could spend time just talking about that. But there are a lot of reasons why somebody might be at higher risk for obesity. We know that continues to be true despite greater opportunities for physical activity, community participation, better health status. The newest Down syndrome growth charts were recently released. This was the first new set of growth charts in about just under 30 years. And the newest growth charts continue to show a shift of about 1 standard deviation on the body mass index curve, which is a curve that helps us understand how well proportioned someone is, their weight in proportion to their height. It shifted about 1 standard deviation up compared to their genetically typical peers. And so it basically shows us that this continues to be a challenge, and it can challenge people in a lot of ways with their health as they grow older. But some of the benefits, so one of the things we can do to help with that is physical activity. And it's interesting because it's kind of exciting that there are some demonstrated physical benefits for people with Down syndrome for being physically active. And some of those are physical, so decreased obesity and or improved body composition, meaning better lean muscle mass, improved strength and balance, which can help you in lots of ways in terms of participating in your job and in the community, improved cardiovascular fitness or endurance for activities, improved bone density, which it turns out is actually a particular issue for adults as they age. And so it's a really good thing to be able to build that bone density. And also some interesting newer work that suggests that it may lead to reduced inflammation. A nice thing that's also been found relatively recently in relation to being physically active is that in addition to helping our physical health, it also helps with cognitive skills. And we find that people have better motor dexterity. And some studies have found, and this is a few nice studies, not real big, but have actually shown improvements in cognitive functioning or executive functioning, which is really exciting, so that there are lots of good reasons to stay active. Diet is another component in health, and we know that folks can be at higher risk for particular nutrient deficiencies, and the two that have been best described are iron and vitamin D, but there may also be a risk for deficiencies in zinc and vitamin A. And other nutrients. And so just focusing on having a healthy, well-balanced diet and supplementing if needed if a person isn't able to or doesn't typically take in certain dietary components. Again, I don't want to go on and on about obesity, but I think, as I was thinking about this and preparing for this, it just impacts lives in so many ways. It impacts your ability to be active. It impacts your ability to be, it causes pain for some people as they get older. It can affect your ability to really participate in work or in the community. And that can be interactive because if you're not able to do those things, that can affect your mental health and again your cognitive abilities as well. So it's a whole big picture around health and staying physically active. It was interesting though, because when related to obesity, one of the papers that I found was actually a paper that a colleague in the Chicago area, Brian Chicoine, had participated in, and this was done several years back. But they actually found that one of the biggest related factors related to obesity or body mass index was friendships and social participation. And so you kind of see how all these things relate and why you can't just pick one piece of the puzzle. You kind of have to put them all together. The next piece of the puzzle that we're going to talk about is behavioral and mental health. And again, this could be a whole day in and of itself. And we all recognize that mental health is important. We also know that adolescence is full of challenges for all kids, and being a mom of 2 teenagers, I can attest to that. But it really is, it's a time of change and growth and new thoughts about the future. And there may be some unique issues for people who have chronic conditions of childhood, including Down syndrome, because it starts to, this is a time for many people when they start to be aware of how having this condition may impact their future or may impact the choices that they have available to them. And so giving people support around that can be incredibly valuable. And we also know that certain mental health issues may be more prevalent in people with Down syndrome, particularly as they transition into young adulthood, including depression and anxiety, but that those things may not present the same way they would for their genetically typical peers and might get missed. Sometimes they get missed because of what we call diagnostic overshadowing, meaning that somebody says, oh, that's just Down syndrome, and doesn't really think about what else might be going on with a person. And sometimes they get missed because they show up in more quiet ways. So maybe the person just tends to be more isolated, spend time by themselves, doing more solitary activities, and we might miss that there's a new emerging mental health issue. And so I think what I'm saying is I would just encourage people to be aware that those issues can come up and be mindful of that and seek attention early if there is a concern. Related to behavior, I wasn't going to spend a lot of time on that other than to say we know that often people who have behavioral issues as adults that can interfere with their work aspirations and other activities that they participate in, often those behavior issues start in childhood. And what we know is that if we can get a handle on those early and start working on those things early, it can really impact into the future and make a brighter and more successful future for people. And then I wanted to spend a little bit of time just talking about the healthcare transition itself. So actually transitioning healthcare providers or transitioning into receiving care as an adult in the medical system. And healthcare transition is really a process that starts in early adolescence and supports a young person in being a more active participant in his or her healthcare and medical decision-making, and also transitioning from pediatric to adult healthcare. And that can mean different things with different providers. If you're seeing a pediatrician as your primary care physician, then that person only provides care up until a certain age. There isn't a set line, but different practices, it tends to range between about 18 and 26 years of age when they, will typically transition care to somebody with more adult healthcare expertise. And that may be true for subspecialty providers as well, the cardiologist or other specialty providers involved in the person's care. For somebody who provides lifespan care, for example, a family medicine specialist, the change may not be changing clinicians, but it may be changing roles. And so moving from being a kid in a practice to being an adult in that practice with a more active participatory role in that practice. Some special considerations related to healthcare transition are, number one, we know that people, adults with Down syndrome do have, like children with Down syndrome, do have unique health issues, and sometimes it can be hard to identify an adult primary care specialist or subspecialty provider that really have experience and expertise. Unlike for pediatrics, there aren't necessarily clear adult healthcare guidelines, although efforts are moving in that direction. But those are things that sometimes physicians really lean on in terms of helping guide them in providing care. There's also been a really dramatic increase in life expectancy in recent years for people with Down syndrome. But what that means is that maybe somebody who trained a little longer ago has had less opportunity or experience working with folks with Down syndrome. There are also issues related to supporting optimal participation in decision-making and really accessing what we would call a true medical home that can help with coordinating a person's care. I wanted to just share this little list of things to think about or information to find out about when choosing an adult healthcare provider. And this is from a book called The Down Syndrome Transition Handbook, and I'll reference it a little later as well. But some of the things that you may want to think about or ask about is, what is this person's experience with Down syndrome? Maybe they don't have a lot of experience, but maybe do they have a commitment to making sure that this young person has the highest quality of life? And that's a really important thing as well. Do they have a little extra time for appointments? So either because of medical complexity or because the young person may need a little more time to be supported in asking questions that they have about their own health, or asking questions when medical procedures or interventions are being proposed. What is the young person's comfort level with that clinician? Do they feel comfortable, and do they feel like it's a good fit for them? And then does that clinician respect the young person and communicate directly with him or her rather than with his or her caregivers or parents? And then there are other questions related to insurance and scheduling appointments, but I think a lot of it is around relationship and experience. That's really going to be what matters. And then independent decision-making kind of comes into play in lots of areas of transition. There are lots of ways that a person makes decisions about their life, where they live, what they're going to do for a job, financial decision-making. And so all of those pieces are important, but specifically related to healthcare, there is a component of decision-making that's involved. When a person turns 18, they are no longer a minor, and they are entitled to rights and responsibilities to make legal choices as an adult. And it's important to think about, like, how is that going to play out in adulthood, and what additional support a person might need. Most folks with Down syndrome do need some support with decision making because of their cognitive limitations. However, if we don't make some conscious efforts around supporting transition and just say, well, your parents are going to be your guardians and they're going to continue to make your decisions for you, the person may end up being more of a bystander in his or her health care rather than an active participant. And that really raises the issue of decision making as an important skill to support. It's a skill that needs to be developed over time, and it really can't wait until adulthood. We can't say, oh, now you're 18 and now you get to help decide, what we're going to do as far as choosing therapies or different things like that. And if we do that, we really run the risk that a person who doesn't have practice or experience just looks incapable. And instead, if we think about how do we sort of support a person over time in gradually developing more independence with decision making, even with whatever support that they need, by the time they're an adult, they may actually really be able to be a full participant in that decision making process. I just want to mention there are a range of options for supported decision-making. Guardianship is the most restrictive, but even within guardianship, there are some options related to level of support. I was trying to think about, like, what are some things that we could teach or skills that we could strive for in terms of helping to support participation in healthcare for adolescents. So thinking about starting early, can the person learn to name and describe each of his or her health conditions in a sort of standard, straightforward way? Can that person learn the names of their medications he or she takes and why they take those medications? And what would happen if they just decided not to take them, or if they missed a dose? What is that going to mean for them? Different ways of having that information readily available, if it's easy to forget, or if there are literacy issues, might be carrying a card in the wallet, or even having something on a person's cell phone that also has that information. It's also, a really great thing to work on is helping a young person prepare a list of questions prior to medical visits, and then support them in actually asking those questions at the visit. And again, smartphones have been a great tool for this because you could just record what your question is and you don't have to remember it when the visit comes. You could just play it back, or you could write it down, or, there are lots of different ways to do that. But we really encourage, kids as they're getting older to be able to ask their own questions. And I think also what it does is help reflect in advance of the visit. What does that doctor do? What is the purpose of that visit? And what kind of questions might be helpful or appropriate when we go to that doctor visit? And then, in tandem with that, gradually increasing participation in medical decision making. I wanted to also just share with you some resources because, again, we're just barely scratching the surface of transition today. And one really wonderful resource that's a national resource is the Got Transition website. And that's particularly geared toward medical decision making, but also has information around, your options for supports related to decision making, and also information about, the transition from child to adult healthcare, including for it's for young people themselves, for parents and caregivers, and also for medical providers who want to know more about transition. Because I really didn't focus on that today. I'm sort of focusing on family and young adult roles. And then other great transition resources. We have some really wonderful resources in our state of Wisconsin. And Amy Lyle, our social worker from the Down Syndrome Clinic, is out at the table with information from our Family Resource Center. And you see up on the screen this transition healthcare checklist. It is a wonderful tool. It is a really wonderful tool and talks about transition, not just about just about healthcare transition, but about career transition and educational transition. It's really a nice pretty comprehensive book that's meant for a young person and their family to use together. It's available online as a PDF, and there are also copies of that booklet bound up at the resource table. And then there's also, just more broadly, a Health Transition Wisconsin website that you can access that has lots of other information available. And then finally, I just included a picture of that Down syndrome transition handbook that I had referenced earlier, and that's available through Woodbine House Publishing. So when it comes right down to it, when we're thinking about transition, really, I'm just going to echo what Erin said, which is it's important early on to think about what are our goals and what are our dreams for the future, and then think about, in a very planful way, how do we develop the skills that are needed to get there, and what are the supports that we're going to need to achieve those goals or those dreams, and start early. And then our hope is that when we arrive on the other shore, despite the rocks and obstacles in the way or storms that we've encountered on our journey, that we really will get to a future that's bright and beautiful and just what we